This is Mike. He is a patient who developed reflex sympathetic dystrophy and complex regional pain syndrome following several surgeries on his left elbow. That occurred following an accident, a work-related injury. What he had noticed over a period of years was that he was losing function through the left upper extremity and shoulder. It had progressively worked from the hand to the elbow to the shoulder, where he would develop severe spasms and pain. He would rate his pain levels at 8 to 9 out of 10 on a consistent basis. Greatly restricted range of motion to the point that his arm was effectively of no use. He couldn't use it for any activities. And when he came to see me and I did the evaluation, at that point, even then, he was very hypersensitive, wouldn't allow me to even really touch his arm because it was so sensitive. So we started doing some treatments, and one of the things that we incorporated into his treatment was the pool. I felt that doing aqua therapy would allow him to move the arm in a more relaxed, comfortable environment with being weightless. It was noted that once he actually got in the pool and we started working with him walking, that it had started to influence his entire nervous system. He was very ataxic, or had a lot of difficulty with his gait, where he would almost be off balance. And having the camera system really helped him, because he could see this, and it helped him with biofeedback and visualization, and helped him improve that ability and the feedback so that he could regain his ability to walk. Normally what he would do is he would start off just at a general pace, just to kind of get limbered up and walk. Initially he would not move the left arm because it was too difficult, but as he got better with things, it would start to move, and he was able to incorporate that into his walking stride. And now you're seeing him approximately 2 years later from where he was, and I'm going to speed up the treadmill a bit for him to show him he can run, and he does really pretty well. Number three. So gradually and progressively we would increase his speed and the jets that we used. The increase in jet pressure would make him have to work even harder through the shoulder blades and trunk, working really on building strength through the thoracic spine, which was integral into the sympathetic nervous system and function there. Progressed from basically walking at about 1 mile an hour to, I think he eventually has gotten up to about 6 miles an hour running, with the jets at anywhere from 60 to 75%. Mike was definitely a very hard worker. He would push himself, but I think that benefited him quite a bit. I think one of the things that's nice about the HydroWorx system is with the cameras, with the different views, it makes a really big difference. You can pick up changes in gait patterns, various muscle tightnesses or restrictions of soft tissues at joints, as well as poor muscle recruitment patterns. After running, we would usually finish with a cool down period for him to just walk a bit. And working against the jets, you can see how when he's striding, he's really involving the left upper extremity and the shoulder blade, and really worked those muscles for him. We had developed a series of exercises to help Mike strengthen all the scapular stabilizers. And at first, it was just even an effort just for him to engage and start to recruit those muscles. So obviously we had the jets turned down, there was no resistance. At that point, we were just using the buoyancy of the water to help him try to start moving. Now he's progressed that when he does the exercises, he works against the jet pressure anywhere from 35 up to 60%. I think one other aspect of the water that really helped for Mike was, in the beginning, he would really experience severe muscle spasms. Oftentimes it would keep him awake at night, really restrict his range of motion. But using the water, after he was in the water, it would allow us to really work on his stretching and flexibility, and we would do a lot of myofascial release techniques, and that also enhanced his ability to regain range of motion and strength through the arm and shoulder and thoracic spine. Now Mike's combining the water dumbbells against the resistance. The small openings allow for the water to pass through, but it creates quite a bit of drag, which really then creates a lot of resistance. And by using the jet speed, we can control and increase that even more. I'd say one of the additional things that people often notice when they're in the water is that they're not quite aware of how hard they're working when they're in the water. Although they're working hard, they can move with so much more ease. But when they're out of the pool, then they really are aware of how much they've been working and how their muscles have fatigued and gotten a good workout. I think using the HydroWorx pool was a good stepping stone for us to advance him from really having difficulty doing any type of exercise or neuromuscular education to the point that he could do quite a bit more. I also think because of the water, it lessened the hypersensitivity that he had to touch. We've used the pool with a number of other patients who have had RSD, both in the upper and lower extremities, and have had very good results.
When I came in, my arm was at a 45-degree angle. Couldn't bend it. Jeff put me in here. No, this is the only thing. I've had 4 surgeries. Nothing worked. This was the only thing that worked. I came in here, I couldn't believe it. It took me about 3 months to get my arm straightened out. The walk took me a couple months because I didn't realize that I was so protected to this left side that I was leaning, and then I saw it on the camera. So it took a while, but you know, I come into the pool 3 times a week, and it worked miracles for me. You know, I just wish I had this 11 years ago. You know, I think it would have avoided a lot of what I had. Yeah, I went back and got a bachelor's degree and a master's degree while all this was going on. And this helped me. The days I was in the, remember this, Jeff? The days I was in the pool, I was able to sit through classes. Right. The days I was not in the pool was a difficult class. I've come here first.
Mike had an injury at work on his left arm, and it was diagnosed as an ulnar nerve injury. So they did surgery when he didn't respond to conservative treatment. This was back 11 years ago, actually, when he had the original injury. Subsequent to that, he continued to have pain and was having difficulty with mobility and movement of his left upper extremity and arm. So they did a second surgery, and they actually followed that with 2 more surgeries. So he had ultimately had 4 surgeries on his elbow. They then felt there was nothing else they could do. However, he continued to have worsening symptoms of pain, spasms, poor mobility, decreasing strength, to the point that his left upper extremity was essentially paralyzed. He could not use it for any activities. And that's how, when he came to me, that's how he was. He wouldn't allow me to move his arm, he wouldn't allow me to touch his arm because it was so painful. And he was very sensitive about that. He had a lot of hypersensitivity to touch. He was very sensitive because in other modalities that had been attempted with electrical stimulation, things like that, it had gotten worse. So we sat down, we talked, and I proposed a plan of care for him, which involved using the HydroWorx pool. And that was something he had not tried before. There had not been any attempts at aquatic therapy. So we began to do that, and he responded slowly, but responded and began to gain momentum, and he would gain range of motion, he would gain strength and function of the left upper extremity. And more importantly, his pain was lessening, he could sleep, he was able to go back to school to get a degree so that he could then teach because he couldn't go back to the work he was doing. So it really allowed him to do a lot of things that he had not been able to do before that. Well, partly, as I kind of reviewed his history, I felt that it was one modality that had not been attempted. He had tried many of the other modalities, from ultrasound and electrical stimulation and just land-based exercises, and all of that had failed and had not helped him, in addition to medical treatments of medications, injections, and so forth. So after reviewing that, I thought, well, here's a means that we can try that's not been tried that would also allow him to move and to do exercises, and I think in general aquatic therapy is good for that. So it just seemed like a natural thing to attempt. Well, the initial activity of just being in the water, he had a lot of balance issues because the reflexive sympathetic dystrophy begins to more or less affect the entire nervous system, and he was to that point where it had begun to affect his muscles and up and through the spine, the rhomboids and so forth, all the stabilizers of the spine. It was beginning to affect his left lower extremity. He had difficulty controlling the left lower extremity. So in the beginning, it was just a matter of getting him in the water and allowing him to not have that pressure and just weight-bearing, weight shifting side to side, forward and backward. Working on thinking about moving the shoulder blade, working on moving different muscles through the left upper extremity. And from there we progressed to walking on the treadmill at very slow speeds initially, because he almost staggered on the treadmill because he was off balance. But again, as he got better and he got more feedback and could start to control and recruit muscles better, that improved, and then we would increase the speed to the point where eventually he was running. We started then advancing the exercises for his upper extremities to involve a lot of scapular activities, scapular strengthening, scapular stabilization, and worked out and progressed distally towards the hand, where he would just work on gripping activities in the pool. He would rotator cuff type strengthening exercises in the pool, and that sort of thing. Just in the fact we would chart what he was doing, that was one benefit. Charting the fact that his pain was less. We do a lot of outcome measures, the Dallas Pain Questionnaire, we do the pain visual analog scales and so forth. And we would then monitor his progress on that. So every 4 to 6 weeks he's completing these, we would do reevaluations with him. And you could just see that his strength was improving, his mobility, his functional use of his left upper extremity would increase, he was sleeping better. So these were all then functional things that he could do, activities that he could not do before. So they were just, noted in the chart and noted by him. He is actually to the point that he has been discharged. He comes back on an as-needed basis. With RSD, it's not something that's ever cured. It's always there. We're always managing and keeping in control. But at this point, he's working. He works as a teacher. Whereas initially, when he would take classes, he had someone who would actually come in and type for him and take his notes because he couldn't write. He was left-handed. He now types. He can use a computer. He essentially functions independently. I think it allows people who can not exercise in any other means to start to basically move and exercise. I'm a really big believer in mobility and exercise, proper recruitment of muscles, and sometimes people just have either too much pain or inability to do that, and water allows them to do that because of the buoyancy factor. It basically is unweighting them and allows them to feel comfortable with movement. And a lot of the patients that we treat are chronic pain patients. They've had pain for a long time. They really have no concept of what it's like to be without pain. So sometimes being in the water and taking that pressure off their joints and their muscles just allows them to have that freedom, and they really enjoy it. And it allows us then to make a progression from strictly water-based aquatic therapy, usually supplemented with manual therapies, to a land-based program, ultimately with the objective being to develop a land-based home exercise program for them.